Hi, Miss Hobin. My name is Nicole. I'm a student nurse and I'm going to be doing your head to toe assessment today. I'm washing my hands and cleaning my stethoscope. Could you tell me your full name?
Alicia Hobin.
And your date of birth?
11/17/1990.
Great. And could you tell me where we are right now?
At my home.
And what day it is?
Friday.
Okay. So, patient is alert and oriented ×3. She appears calm and cooperative. Her vital signs were taken before this assessment and they are stable, and her BMI is adequate to her height and weight. Through this assessment, we're going to have to be doing some moving and I'm going to have to touch your body. Is that okay?
Mm-hmm.
All right. And are you feeling any pain right now?
No.
And do you have any allergies? Okay. So we're going to get started on your hair, skin, and nails. Patient's hair is brown and clean. Her scalp shows no signs of redness or lesions or infestations. Skin is warm and dry throughout. I see freckling all over the body, which is normal. I see your hands? Nails are short and round. They're clean and evenly distributed. And capillary refill is less than 2 seconds. Head is normocephalic. Do you have any pain? So no pain upon palpation of the scalp. Features of the face look symmetrical, and I see no scarring or lesions on the face. We're going to test your cranial nerve 5 first, so we'll do the sensory portion. This is the trigeminal nerve. I'm going to have you close your eyes and let me know when you feel my cotton ball.
Yep. 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 Yep.
Great. And now we'll do the motor portion. This is still cranial nerve 5. So I'm going to have you open and close your mouth a couple times. Good. And now side to side. And now clench your teeth. Great. Now we'll test cranial nerve 7, the facial nerve. So could you smile and frown and now puff out your cheeks? Good. And now raise your brow. Awesome. Do you have any pain here?
Nope.
So no pain upon palpation of the frontal or maxillary sinuses. I'm going to palpate your temporal artery. And I have a bilateral pulse of 2+. Now we'll move on to your eyes. So eyes look symmetrical. The hair distribution of the eyelashes and eyebrows looks even. I see no drainage or redness. Could you just look up for me? Good. Sclera are white and conjunctiva are pink. Do you have any pain in there? So no pain upon palpation of the lacrimal apparatus. Now we're going to test your optic nerve 2 with the Snellen chart. I'm going to have you read the lowest line that you can.
STU.
Great. So a patient has 20/20 vision, which is normal and means that she can see what a normal person can see from 20 feet. Now we're going to do another test for optic nerve 2. I'm going to have you cover one eye and tell me when you can see my finger.
That's it. That's it. That's it.
And now the other side.
That's it. That's it.
Good. So that tests her peripheral vision. Now we're going to test cranial nerves 3, 4, and 6, the oculomotor, the trochlear, and the abducens. So I'm going to have you look straight ahead. Great. And now follow my light. Good. So pupils are equal, round, reactive to light, and accommodating. And now I'm going to have you follow with just your eyes. And this test for any extraocular movement. Good. Now we'll move on to your ears. The outer ears are symmetrical. I see no redness or drainage. Do you have any pain? Good. Now, to look inside the ear, we would use an otoscope, and we would pull the pinna up and back. Look looking inside, we're looking for some cerumen that's present and making sure there's no redness or abnormalities of the ear canal. Then we're looking at the tympanic membrane, and I'd be looking for a pearly gray color, no redness or bulging, and a cone of light at about 5 o'clock on the right side. I would do this on the left side too, and the only difference that I would be looking for is the cone of light at about 7 or 8 o'clock. Now we're going to test your vestibulocochlear nerve, cranial nerve 8. So I'm going to whisper 3 words and have you repeat them back to me. Wall, paper, curtain.
Wall, paper, curtain.
Great. Next, we will look at your nose. It's midline. I see no deviation or any external abnormalities of the skin. Could you lift up the tip of your nose for me? Inside, I see pink and moist mucosa. 2 turbinates are visible on each side, and the septum is midline. It's not deviated. We would test your olfactory nerve, cranial nerve 1, by having you close your eyes and sniff something on each side to make sure that your sense of smell was intact. Now we'll move on to your mouth. So could you open up? Alrighty. Buccal mucosa is pink and moist. The tongue is pink and bumpy. Could you show me the floor of your mouth? It's purpley pink and viscous. Now put your tongue down. And the hard palate is whitish, soft palate is pinkish. I see no dental caries. Now we're going to test cranial nerves 9 and 10, the glossopharyngeal and the vagus. So I'm just going to have you open up and say, ah. Good. The soft palate and uvula raise on phonation, and the uvula is midline, which is what we're looking for. Now I'm going to test your hypoglossal nerve, cranial nerve 12. So if you could just stick your tongue out and bring it right back in. Good. And that tests for tongue strength, and it came out midline, which is great. Now we'll move on to your neck. So the neck, I see no masses or bulging. The skin color looks consistent with the rest of the body. It's midline. The trachea is midline. And I see no rashes or bruising or lesions. We're going to palpate your lymph nodes. So we have the preauricular, postauricular, occipital, jugulodigastric, submandibular, submental, superficial cervical, deep cervical, posterior cervical, supraclavicular, infraclavicular, and now the axillary lymph nodes. So we have the lateral, the medial, the anterior, and posterior. And did you have any pain anywhere? And I was not able to palpate any of the lymph nodes, which is normal. Now I'm going to test your spinal accessory nerve, cranial nerve 11. So I'm going to have you push against me and push. Good. And raise your shoulders. Great. Now I'm going to check your posterior thorax. So if you could just turn a little bit, and I'm going to move my camera. All right. So first we'll look at the skin of the back, and I see no abnormalities, no moles or rashes. Skin looks even and consistent with the rest of the body. The curvature of the spine looks normal, and I see no signs of scoliosis, lordosis, or kyphosis. Do you have any pain?
No.
All right. No pain upon palpation of the spinous processes. And every time I move my hands, I want you to say the word 99.
99, 99, 99, 99. 99.
Great. Tactile fremitus is equal bilaterally. And take a deep breath. Good. Chest expansion is equal bilaterally. Let me know if you have any pain. Nothing?
Nope.
Okay. So no CVA tenderness is an indication that there's no inflammation in the kidneys. Now we're going to listen to your breath sounds. I'll listen in using a ladder formation. So we'll start at the top and just take a deep breath. Great. So I heard equal and clear breath sounds throughout with no adventitious sounds. So now we're going to move to the front. And I'm just going to move my camera again. All right. So I see no extra effort upon respiration, and I see that the skin is consistent with the rest of the body with no rashes or bruising. Do you have any pain? No. All right. No pain upon palpation of the anterior chest wall. And now I'm going to listen to your breath sounds again. And the same thing as the back, just take a deep breath. Okay, I hear clear breath sounds bilaterally and no adventitious sounds, so I would be listening for any wheezing or crackling, but didn't hear any of that. And now I'm going to feel your carotid pulse on each side, and it's 2+. And now if we were to listen for the carotid pulse, we listen with the bell of the stethoscope, and we would start at the midline, up to the jaw, and down to the base. And we would do this bilaterally to check for bruits. Now I'm going to have you lay down and we'll start your cardiac. All right. If I had one, I would shine the light across the patient's chest and abdomen for this portion to make it easier to view any pulsations within those areas. I see no extra heaves or lifts happening in the cardiac area. Inspecting the jugular veins, I see no distension of the exterior, and I see a slight pulsation of the interior, which is normal. Now I'm going to feel for any thrills. And I feel no vibration, which shows that no thrills are present. Next, I'm going to palpate the apical pulse, which is at the 5th intercostal space, mid-clavicular line. And the pulse is palpable and 2+. Now we're going to listen to the heart, and we'll start first with the diaphragm at the aortic, which is at the 2nd intercostal space, right sternal border. Then the pulmonic, which is at the 2nd intercostal space, left sternal border. Erb's point, which is at the 3rd intercostal space, left sternal border. The tricuspid, which is at the 4th intercostal space, left sternal border. And the mitral, which is at the 5th intercostal space, left sternal border. And now I'm going to have you turn onto your left side. And I'm going to listen in the mitral space again with the bell of my stethoscope. This is called the mitral maneuver. We do this to bring the heart closer to the chest wall for better listening. And you can come right back. And I heard all heart sounds and no extra sounds. Now we're going to go back up in that same formation but backwards with the bell of the stethoscope. So I'll start at the mitral to the tricuspid, Erb's point, pulmonic, and aortic. And I hear no extra heart sounds, so we can move on to the abdomen. All right. The abdomen appears soft and flat. The skin is consistent with the rest of the body. First, we're going to listen to the abdomen for bowel sounds. I'm going to listen with the diaphragm and start in the right lower quadrant, up to the right upper quadrant, left upper quadrant, and the left lower quadrant. And I heard bowel sounds in all 4 quadrants. And now I'm going to listen with the bell of my stethoscope to the vascular sounds. So we'll listen first to the aortic, which is about 2 inches above the umbilicus midline. Then the renal, which are about 1 inch or 2 to the left and right. Then we go down to the iliac, which are about 1 inch or 2 below the renal on the left and right. And all the way down to the femoral, which are 1 inch or 2 below the iliac on the left and right. And I hear no bruits present. So now we're going to percuss the abdomen in that same rotation, starting in the right lower quadrant. Down to the left lower quadrant, and I heard tympany throughout, except for a little bit of dullness in the right upper quadrant, which is normal because that's the lower border of the liver. Now we'll do some light palpation all the way around in that same rotation, up and around. And do you have any tenderness there? And I didn't feel any masses. If there was a need for it, a provider would perform deep palpation. And you can sit up. And we're going to start with your upper extremities. So skin appears normal, no signs of cyanosis or extreme pallor. Turgor is good with no tenting. Do you have any pain? No. All right. And now we would check your pulses. So we would start with the brachial. And that's 2+, the ulnar, and the radial. And those are both 2+ as well. We would check this on both sides bilaterally to make sure that all pulses are 2+. Now we'll move down to your lower extremities. Could you move back a little bit? All right. So the skin is consistent with the rest of the body. I see no abnormalities, edema, or redness. The hair distribution is even, especially in the lower shins. Do you have any pain? No. How about on this side? No. All right. And we'll double check any calf tenderness. Good. And I see no varicose veins. Capillary refill on the toes is less than 2 seconds. And now we'll feel your pulses, first for the popliteal, which is right behind the knee. And that's not palpable, which is normal. Let's try the other side, just in case. I don't feel anything there, but we would want it to be 2+ bilaterally. Next, we'll do the posterior tibial on the inside of the ankle. And we would check bilaterally to make sure that they're both 2 plus. And last is the dorsalis pedis, and it is right midline between the first and second toe on the top of the foot. And that is 2 plus bilaterally. So I'm going to have you hop down, and we'll move the camera, and we're going to do your range of motion for your musculoskeletal. So first we're going to start with the neck. I'm going to have you flex towards your chest, and then extend all the way back. Good. And now touch your ears to your shoulders. Good. And now I'm going to have you do your shoulders. So it's going to be flexion straight out and extension all the way back. And now we're going to come up and around for exterior rotation, and now down and around and in for internal rotation. Now you'll go straight up, abduction and adduction. Good. Now if you could push against me. Good. Strength is 5 out of 5. And now we're going to do your elbows. So I'm going to have you flex and extend. And now you're going to do pronation and supination. Good. And now flex your elbows again. Pull against me and push against me. Good. Strength is 5 out of 5. We're going to move on to your wrists. So straight out, we're going to do flexion and extension. And now I want you to bring your thumbs towards your belly and back out. Good. And now fingers, we're going to do flexion and extension and then spread them out. Great. So push against me and now push this way. And same with the fingers. Good. Strength of the wrists and fingers is 5 out of 5. Now we'll face this way for our lower extremities. I'm going to have you do the hips first. So we're going to do flexion and extension. And now we're going to do abduction and adduction. Next it'll be internal rotation and external rotation. And we make sure that we check this on both sides to make sure that the range of motion on both sides is full. Now we'll move to the knee. So we're going to do extension and flexion. Good. And now you can get up for your ankles. So we are going to do the ankles. We're going to do inversion, yep. And now eversion, good. And now could you do dorsiflexion and plantar flexion? Great. And now we're going to test so you can relax. Could you pull against me and push against me? Good. And now do the same with your feet. Push up and down. Great. So strength of the knees bilaterally and ankles bilaterally is 5 out of 5. You can hop down one more time. We're going to assess your gait. Before we assess your gait, we have to check your range of motion on your spine. So I'm going to have you face, yep, and we're going to do flexion and bend as far back as you can for extension. Good. And now we'll twist and then side to side lateral bending. Good. So range of motion of the spine is full. Now we'll assess your gait. I'm going to have you walk 3 steps that way and then come back on your toes. Good. And now walk back that way on your heels. And come back with a tandem walk, which is toe to heel. Great. So patient's gait is uninterrupted and smooth. We're going to test your balance. So I'm going to have you put your hands by your side and your feet together and close your eyes. This is called the Romberg test. We would do this to test the patient's balance and make sure that they can stay in this position for up to 20 seconds. A little bit of swaying is normal, but if they were to fall over, that would be considered a positive test, and we would call that an abnormality. You can open your eyes now. And now I'll have you get back up, and we'll test your reflexes. So for the neurological tests, we would make sure that the patient is alert and oriented. So could you please tell me where we are right now?
At my home.
And what year is it?
2020.
And what's your last name?
Hobin.
Great. So patient is alert and oriented times 3. I'm going to check your sensation on all of your extremities. So I have a soft object and a sharp object. I'm going to touch you with them, and I want you to tell me which one you're feeling with your eyes closed.
Sharp. Soft. Soft. Sharp. Sharp. Soft.
Good. Now we'll move on to the lower extremities.
Sharp. Soft. 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 Sharp. Sharp.
Good. So sensation is good in all of the extremities. Next, we would test your reflexes. So the first one would be the bicep. I would use the hammer right here, and we would be looking for finger movement. Next would be the tricep. It'd be right here above the elbow, and we're looking for lower arm movement. Then it would be the brachioradial, which is right above the thumb, and we're looking for thumb movement. Then we would move down to the patellar, which is right below the kneecap, and we're looking for lower leg movement. Then we would do the Achilles, which is right behind the ankle on the Achilles tendon. We'd be looking for foot movement. And last, we would do the Babinski, which would be an upside down J on the bottom of the foot. In an adult, we're looking for no reaction. In an infant up to 2 years old, a reaction would be fanning of the toes. If an adult were to have that reaction, that would be considered an abnormality. For all of our reflexes, we would be sure to do them bilaterally, and we would rate them on a scale of 0 to 5, and normal would be 2+. Do you have any other questions for me?
No.
All right, and that's the end.